Hey everyone, it's the Autoimmune Dietitian back with another video about autoimmune disease and nutrition and the link between the two of them. So for those of you who don't know me, my name is Annie Rubin. I'm a registered dietitian nutritionist and I am the Autoimmune Dietitian. You can follow me on YouTube. I also have an Instagram page, the Autoimmune Dietitian, and on Facebook you can find me at annierubin.com. So today we are talking about nutrient deficiencies that we commonly see in joint-related autoimmune conditions. So for those of you who don't know, I've been living with rheumatoid arthritis for almost 14 years. And let me tell you that there's nothing ever constant when you're living with a chronic disease. One of those ever-changing things is nutrient deficiencies. These can fluctuate over time for many reasons, but it's important to stay on top of them in order to continue your healing journey. So today I am giving you my top nutrient deficiencies that we commonly see in joint-related autoimmune diseases and how to start fixing them. So before I jump in, I need to attach my usual disclaimer that information in today's video is not a substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes to your medical care, including supplements. We don't think of supplements as something that we should tell our doctor about, but absolutely. Supplements can interfere with medications and interfere with treatment. So always be very honest and open and ask questions in terms of which supplements you should take. Okay, so the first nutrient deficiency we typically see is vitamin D. So if you've listened to any of my videos, if you watched me on Instagram Live, you definitely have heard me talk about vitamin D. This is a vitamin that's generally low in all autoimmune conditions and can be a real game changer for when when you get your levels up. So vitamin D is a fat-soluble vitamin. It plays an important role in our immune system regulation. It's important for bone health. It's important for brain health, sleep quality, and it can even reduce your risk of developing cancer. It's like this amazing vitamin. But vitamin D deficiency is commonly seen in joint-related autoimmune diseases. And what's really interesting is that your vitamin D status is directly correlated to your disease activity. Multiple studies have shown that you have a decrease in disease activity as your vitamin D status increases. So again, low vitamin D, more disease activity, more flare chances. So when you get your levels back up to normal, disease activity tends to calm down. So you want your levels to be somewhere between 50 to 60 nanograms per deciliter, even though the normal range can go as low as 20. Your doctor may tell you your vitamin D is fine. Take the initiative, look at your lab value. You want it to be between 50 and 60. The best source of vitamin D is sunlight, but I know that can be challenging for some people who are either A, they don't live in a sunny place, or B, are at high risk for skin cancer and wear sunscreen a lot, like myself. So if you choose a supplement, which I do, choose a vitamin D supplement with K2. You want to look for something that has MK7. It's a homolog of vitamin K2. The MK7 has actually been shown to increase bone density alongside vitamin D. It helps your cells in your bones uptake D. So definitely look for that combination. Okay, the second one is folate. Folate, which is also known as vitamin B9, is responsible for energy metabolism. It helps create red and white blood cells. It's also needed for methylation reactions, and it helps produce DNA and RNA. So people with rheumatoid arthritis, lupus, even MS, even though MS is not a joint-related disorder, we all can benefit from an increase in folate intake. So one study of rheumatoid arthritis patients found that those who had a serum folate levels above 8.2 nanograms per deciliter had reduced risk of cardiovascular disease. We all know that when you have rheumatoid arthritis, your risk for cardiovascular disease increases. Also, people who have rheumatoid arthritis who are taking methotrexate absolutely need a folate supplement, as methotrexate basically drains your body of folate and it prevent cells from replicating, which is how the drug works. So good sources of folate include beef liver. I'm a huge fan of organ meats, spinach, asparagus, Brussels sprouts, avocado. The other issue with folate is something called methylation, which is a whole other important discussion that I will hopefully talk about at some point in the future. But in a nutshell, for people who have methylation issues, they should take a more active form of folate, which is 5-methyl tetrahydrofolate, or 5-MTHF. instead of folic acid. So just keep that in mind. And I'll also mention that a lot of people with autoimmune diseases also have methylation issues. So switching to a methylated form of folate might be a good idea. Okay, the third one is zinc. So zinc is a potent antioxidant, and it also helps support the immune system. So as we've all lived through COVID, many people started upping their zinc intake just for that reason, to boost their immune system. And that's why it's a, really great antioxidant. Most autoimmune warriors are low in zinc, so making sure that you eat foods rich in zinc is super important. For joint-related diseases, inflammation is an indicator of disease activity. And when inflammation is present, your cells actually need more zinc than usual. So that can actually be one of the reasons why you have low zinc, is because inflammation is sucking up all the zinc in your body. The one thing to know, if you have lupus, too much zinc can actually exacerbate lupus symptoms. So when you have lower zinc levels, it actually does improve symptoms for lupus. So be really careful about that. Good sources of zinc include oysters, red meat, poultry, and beans. You can find zinc as a supplement. You either want to get zinc gluconate, which is the cheaper and more available form, or zinc picolinate or picolinate. I don't know how you say that. The picolinate version tends to be more expensive, but it also is better absorbed. So choose whatever works for you. The last one is calcium, and it's really because of bone health. When we're dealing with joints, bone health is critical, which is kind of where calcium fits in, because calcium is found in our bones. So people who are taking glucocorticoids are generally at risk for osteoporosis. Glucocorticoids, this includes things like prednisone. It triggers bone loss. It basically causes your bones to leak calcium. Additionally, when you have joint pain, it's tough to be active. Less physical activity means less weight-bearing activity, which means you're not building up your bone tissue and increasing your bone density. People with joint pain also tend to have more bone loss around the joints. So you can prevent bone loss by addressing several different areas of health. The first one is obviously diet. Aim for at least 800 milligrams of calcium daily. If you follow a paleo diet, your best sources are almonds, leafy greens, canned fish with bones, so things like canned salmon with bones, sardines, herring, anything with bones that gives you that extra boost of calcium. Sesame seeds, molasses, and broccoli are also rich in calcium. Exercise. Strength or weight-bearing exercises are best. They help build bone density. Don't start any exercise routine without clearance from your doctor, though. So make sure that you are okay to exercise. And then nutrients. So vitamin D and K2 and magnesium are all important for bone health. So make sure that you're including those into your daily routine. Okay, so just to recap, we focused on the common nutrient deficiencies for joint-related autoimmune diseases. These include vitamin D, folate, zinc, and calcium. So for those of you who would like additional support in managing your autoimmune disease symptoms, I would love to chat with you. You can go to my website, AnnieRubin.com. You can go to my Instagram bio. There's links on both places to schedule a free call with me. There's no kind of it's free. You don't have to sign on with me. I just would love to chat with you. I love talking to people about their disease and how diet can help. Again, you can follow me on Instagram. You can follow me on Facebook. If you liked the video, definitely hit that subscribe button in the bottom. I put these videos out every week. And I'm always talking about something, along the lines of nutrition and how it can help you manage your autoimmune disease. So thank you so much for joining me. Click the subscribe button to keep watching, and I will see you next week. Thanks.